Welcome back to Newsfeed PM. Straight into business now. To mark World Food Day, the continent's largest retailer, Shoprite, has commissioned a study to track South Africa's food security. The 2024 South African Food Security Index has come up with some concerning findings, showing that food security is at its lowest point in over a decade. The study says some 4.7 million people in the country are not meeting their minimum calorie requirements. This means that more South Africans experienced greater food insecurity last year. We're now joined by Professor Dieter von Fintel, Professor of Economics at Stellenbosch, one of the members that put together this particular index. Dieter, South Africa is an unequal society with a wide gap between the have and the have-nots. So what kind of metric did you have to use to measure food insecurity in South Africa?
Yes, that's quite correct, because we often say that South Africa as a country is food secure. There's enough to go around. There's actually enough food in the country for everybody. So you mentioned the kilocalories. If you just look at the number of tons of food that are available either through production or imports, there's actually enough in the country. The problem is the gap between what happens in the shop and the plate, if we could call it that. And who are the people where the food doesn't reach the plate and the right food doesn't reach the plate. And really what we see here is that this is what causes hunger. We were able to see which households are hungry, and that gives us a sense of where this gap is. And it's typically the poorest households. We know that approximately 25% of the poorest households experience some form of hunger, especially, they experience some form of hunger, 25% of them in 2023. Yeah. And, we can also see this in the large stunting rate, which we have in South Africa, where about 1 in 4 children is also below their height.
And this is, of course, a hit on nutrition. But when we look at some of the basic food items that a lot of South Africans are going without, what are those, and are those part of the measure?
Yes, so we struggle a bit to measure that, because our goal is to really get survey data that we can compare over time. And what we see in South Africa is that to get really detailed data every year is very difficult. So we don't know from this data which we have which food sources people are going without. But in a more recent survey, which was done by the HSRC, which was released last week, there we can get more detailed diet information. But what we really see is that people are just not having any food, 10% of households. And also they're indicating that they're not getting, due to budgetary requirements, they're not getting as much different types of food as they would like to. Now, usually the first thing that households get rid of are the more expensive foods. And often these are also the healthier foods. So, one of the things which is probably less healthy that people get rid of is meat. It's more expensive. But any other item that's expensive is usually that people get rid of first. And we see that this is really the problem in South Africa. People buy less healthy food, usually starchy foods that people can afford. And that's the point, when household budgets are under pressure, people buy what they can afford, and it's often not necessarily the most high quality foods.
Now, inflation has eaten away at many incomes in the country and meant even tighter budgets for many households. How has this affected access to nutritious food? What role then should some of these larger retailers play in making sure that the internal inflation doesn't hurt the products too much?
Yes, I mean, this is a serious problem, because we've seen with the food prices internationally have been going up a lot. And South Africa hasn't been exempt. And the figures show that people's incomes have grown much slower than prices, and particularly that food prices have also been much quicker to grow than other prices. So we're in a prime situation where this is happening. And I mean, it's hard also for retailers, for instance, to really respond to that in a big way, because often foods are sourced from producers who are facing these international conditions, right? So food prices are high internationally, so retailers can't necessarily just cut those prices themselves. They, of course, can try to do some of that. What I think is necessary is a collaboration between the public sector and the private sector. So where we can think about zero rating on VAT, some essential items, not just staples, but essential nutritious items, which could contribute to nutritious diets, but which aren't necessarily as expensive as one might think. And then trying to lower the prices of those items in a combination between the private sector and also through the tax system.
You also had a
Review.
look around the provinces around the country, and one would imagine that rural areas would have an advantage in having the space to have subsistence farming and growing their own food. But even there, food scarcity is available.
That's quite correct. I mean, what we find is that rural provinces or rural areas are least food secure. And this is not a new finding. Historically in South Africa, if you look at the early 2000s, the highest hunger rates were in provinces where there were former apartheid homelands. That has come down a lot. So it does suggest to us that at least the smallholder sector has been able to contribute to lower hunger rates over time. But it's kind of like that there's a ceiling effect. But what we do need to do is to improve and assist smallholder farmers to be able to cultivate more and more nutritious foods. I think indigenous foods have a big role to play in contributing to food security, especially from a nutrition perspective, because a lot of indigenous foods are both more climate resilient, but they also have high levels of nutrition that can really contribute to child and adult nutrition. If you think of leafy green foods such as spinach, which are highly nutritious, we could hope that individual households and also smallholder farmers would be willing to grow some of these foods, especially in times of economic pressure.
Now, by 2023, 11.8% of households said they were consuming a lower variety of food than usual given economic constraints. Is there a way that we could find, government working with the private sector to make sure that there is a section that zero rated, as you said earlier, because there are some countries that do make provisions for those who are poorer to try and make sure that they can also afford food, even though it's not the best crop that comes out of that country.
Yes, so we zero rate a lot of staple items in South Africa, and these discussions come about ever so often when there's a panel that comes and decides about important issues. This is not a quick process, and it needs a lot of deliberation, a lot of research. And I think what we'd like to say with this report is it's not just staple items that could be zero rated because households consume them already, but what about items which households don't consume, which are healthy? So this would be a call to open up that discussion, to be able to say, are there some cheaper items which households don't consume enough at this stage, but which zero rating could promote to introduce their consumption even more?
Have you found that it's not just those trading the poverty line in South Africa that are affected by food security, but also those in urban areas who have either lost their jobs or just simply cannot afford the cost of living anymore?
Yes, I mean, this is very important. The fact that there's been high levels of migration, especially in the COVID period, into urban areas, and people are exposed to new environments. Often people come to urban areas in search of jobs. And if they don't find a job, then it makes it quite difficult to put food on the table. So even though there is this migration, it doesn't necessarily guarantee that people are food secure. So food insecurity is high in urban areas. The other element of food security we're not just talking about having food on the table, but it's having the right food on the table. And often when people move from rural to urban areas, they're exposed to a new food environment. And often this food is not the healthiest food. And when these movements from rural to urban areas come about, often this leads to a rise in obesity, which could be a definite concern. In South Africa, we also have high obesity rates. And part of this is when people get access to incomes, right? So it's not just the poorest, but when people gain access to new incomes and they can afford a new type of food, but they don't necessarily consume healthy foods. And this raises their exposure to unhealthy foods. And this is then potentially problematic for long run health problems for particular individuals who've changed these environments.